For decades, the United States has grappled with a devastating opioid epidemic. This crisis has touched every corner of the nation, from bustling cities to quiet rural towns, leaving a trail of heartbreak and loss in its wake. Overdose deaths have soared, leaving countless families shattered. The pain of losing a loved one to addiction is a wound that never fully heals, and communities have been left to pick up the pieces. However, recent data offers a glimmer of hope. Amidst the darkness, there are signs that the tide may be turning. The Centers for Disease Control and Prevention, or CDC, reports a decline in overdose deaths. This news has brought a cautious optimism to those on the front lines of the battle against opioid addiction. In the 12 months leading up to August 2023, 111,802 deaths were recorded. This staggering number reflects the severity of the crisis. By June 2024, that number fell to 93,087. This significant reduction has sparked conversations about what might be driving this positive change. This marks a 16.4% decrease in just 10 months. Such a rapid decline is unprecedented and has given many hope that the strategies being implemented are making a real difference. This decline is a significant development. It suggests that the combined efforts of healthcare providers, policymakers, and community organizations are starting to pay off. It suggests that efforts to combat the crisis may be gaining traction. Programs focused on prevention, treatment, and recovery are showing promising results. However, the reasons behind this decline are complex. Multiple factors, including increased access to treatment, better education about the dangers of opioids, and the distribution of life-saving medications like naloxone, have all played a role. This is not a simple victory. The opioid crisis is a multifaceted problem that requires a sustained and comprehensive approach. While the recent data is encouraging, there is still much work to be done. Communities must continue to support those in recovery and work to prevent new cases of addiction. The fight against the opioid epidemic is far from over, but this glimmer of hope shows that progress is possible. Together, through continued effort and collaboration, we can build on this progress and strive for a future where fewer lives are lost to this devastating crisis. The journey ahead is long, but with determination and unity, there is hope that one day, the opioid epidemic will be a chapter in history, rather than a current reality. One factor contributing to the decline is the increased availability of naloxone. Naloxone is a medication that can reverse opioid overdoses. Public health campaigns have emphasized the importance of naloxone. As a result, more people are carrying it and are trained to use it in emergencies. Additionally, naloxone has become more affordable. This is due in part to government programs and advocacy efforts. Another positive development is the government's crackdown on fentanyl trafficking. Fentanyl, a potent synthetic opioid, is a major driver of the overdose crisis. Law enforcement agencies have targeted Mexican cartels and international supply chains. These efforts have made it more difficult to obtain the chemicals needed to produce fentanyl. As a result, the supply of fentanyl has been disrupted. The drug is becoming less available and more expensive. This scarcity likely contributes to the decline in overdose deaths. While the overall decline in overdose deaths is encouraging, the progress is not evenly distributed. Certain communities are being left behind. Racial and ethnic minorities continue to experience disproportionately high rates of overdose. These communities often face systemic barriers to treatment and support services. Geographic disparities also persist. Some regions of the country have seen significant reductions in overdose deaths, while others have not. Section 5. Skepticism and Sustainability. Some experts caution against celebrating the decline in overdose deaths prematurely. They argue that the factors driving the decline may not be sustainable. For example, the crackdown on fentanyl trafficking could lead to unintended consequences. Drug traffickers may simply shift to other substances, creating new challenges. Additionally, the effectiveness of public health interventions is still being debated. More research is needed to determine the long-term impact of these programs. Section 6. The Rise of Xylazine. One concerning trend is the emergence of xylazine. Xylazine is a tranquilizer used by veterinarians. It is increasingly being mixed with fentanyl and other drugs. Xylazine is dangerous for humans. It can cause sedation, respiratory depression, and skin lesions. It is not easily reversed by naloxone. The presence of xylazine in the drug supply complicates overdose prevention and treatment efforts. Section 7. A disturbing trade-off. Ironically, the presence of xylazine in the drug supply may be contributing to the decline in overdose deaths. Xylazine, a veterinary tranquilizer, has found its way into the illicit drug market, often mixed with opioids like fentanyl. This unexpected combination has created a paradoxical situation. This is because xylazine's sedative effects can prolong the duration of a fentanyl high. When users inject fentanyl laced with xylazine, the sedative properties of xylazine extend the euphoric effects of fentanyl, making the high last longer than it would with fentanyl alone. Users who might otherwise inject fentanyl multiple times in a short period may only inject once if the drug is laced with xylazine. This means that instead of repeatedly exposing themselves to the risk of overdose, they are reducing the frequency of their injections. This reduces their risk of a fatal overdose in that time frame. By injecting less frequently, they are less likely to experience the respiratory depression that often leads to death in opioid overdoses. However, this is a dangerous trade-off. While the immediate risk of overdose might be lowered, the introduction of xylazine brings its own set of severe health risks. Xylazine poses serious health risks and can lead to long-term complications. Chronic use of xylazine can result in severe skin ulcers, infections, and even necrosis at injection sites. Additionally, xylazine is not an opioid, so it does not respond to naloxone, the life-saving medication used to reverse opioid overdoses. This makes it even more dangerous in overdose situations, as medical professionals may struggle to treat those affected. The presence of xylazine in the drug supply is a disturbing development, highlighting the complex and often perilous nature of substance abuse and the ongoing opioid crisis. Section 8. Shifting drug trends. The crackdown on fentanyl has also led to shifts in drug use patterns. As fentanyl becomes less available, some users are turning to other substances. Methamphetamine and cocaine use has been increasing in certain parts of the country. These drugs are not as immediately lethal as fentanyl, but they still carry significant risks. It is essential to monitor these shifting trends and adapt public health responses accordingly. Section 9. A call for comprehensive action. The decline in U.S. overdose deaths is a positive development, but it is not a time for complacency. While the numbers may be encouraging, they mask the ongoing struggles faced by countless individuals and communities. The opioid crisis has deep roots, and its impact is far-reaching, affecting not just those who are addicted, but their families, friends, and entire communities. The opioid crisis is far from over. Despite the recent progress, the battle against addiction continues to rage on multiple fronts. Communities are still grappling with the devastating effects of opioid misuse, and the need for sustained and comprehensive action has never been more urgent. A comprehensive and nuanced approach is needed to address the root causes of addiction. This means looking beyond the surface and tackling the underlying issues that contribute to substance abuse. It requires collaboration among healthcare providers, policymakers, community leaders, and individuals who have been directly affected by the crisis. This includes expanding access to evidence-based treatment and harm reduction services. Effective treatment options, such as medication-assisted treatment, must be made widely available to those in need. Harm reduction strategies, including needle exchange programs and supervised consumption sites, can save lives and provide a pathway to recovery. Addressing social determinants of health, such as poverty and lack of access to healthcare, is crucial. Many individuals turn to substances as a way to cope with the stress and challenges of living in poverty. By improving access to healthcare, education, and employment opportunities, we can help reduce the factors that drive people towards addiction. Reducing the stigma associated with addiction is also essential. Stigma can prevent individuals from seeking the help they need and can isolate them from the support systems that are crucial for recovery. Public awareness campaigns and community education can play a significant role in changing perceptions and encouraging a more compassionate and understanding approach to addiction. Sustained progress requires a commitment to public health, social justice, and evidence-informed policies. Policymakers must prioritize funding for addiction treatment and prevention programs and ensure that these initiatives are based on the latest scientific research. Social justice efforts must address the disparities that exist in access to care and support for marginalized communities. By working together, We can build a future where everyone has the opportunity to live a healthy and fulfilling life, free from the grip of addiction. It will take a collective effort, but with determination and compassion, we can create a society where recovery is possible for all and where the cycle of addiction is broken for good.